Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Let's try to understand what the hormone levels are at the early stages of your period and why we insist on day 2 or day 3 scans and for the treatment to begin around those days for a better success rate. During the first few days of your period, especially day 2, day 3, the estrogen levels are very low. Now this low estrogen is telling your brain to produce more FSH, follicle stimulating hormone. As the name suggests, it stimulates or it helps the follicle inside your ovaries grow. What are follicles? Inside the follicles are eggs. So as the follicle stimulating hormone rises, the follicles also grow. Inside each follicle is an egg. And each follicle will also produce its own estrogen. It's a very important hormone. As the estrogen rises, the eggs also keep growing. Now estrogen is a very important hormone for another thing. It helps the endometrium grow inside your uterus and it makes it very comfortable and cozy for the embryo, the future embryo that might come to implant and grow over there. So estrogen is very important, and as the follicles keep growing, the estrogen also rises. Now the FSH or the brain selects one big dominant follicle, which means to say that this follicle will keep growing and the rest will degenerate. Now due to this, the estrogen level also keeps rising. The rising estrogen is maintained for about 30 to 40 hours, after which there is an LH surge, luteinizing hormone surge. This increase in LH makes the egg ovulate. So you understood that estrogen is very important to help the egg grow, to make the endometrium also prepared for future implantation. After the egg has ovulated, progesterone hormone takes over the maintenance of the endometrium. So all this is very critical, and at day 2 and day 3, when the estrogen levels are low, the follicle stimulating hormone is yet to begin its magic of selecting few follicles to grow for the next period, is when we ask you to come for a scan, and then we decide what medications, what stimulation protocol to give you so that you can get the best results out of the treatment protocol that is decided. If you want to understand more, if you want to undergo any kind of fertility treatment, it could be ovulation induction, IUI or IVF, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.